All right, guys, welcome to the first section of your nursing process lecture. The first portion, we are going to be going over assessment. Assessing is the first component of the nursing process. Assessment is a systemic and continuous collection, analysis, validation, and communication of patient data. So let's look at assessing a little bit closer. Assessing is used to identify nursing and medical conditions. We can detect biases and determine the credibility of information. So, for instance, we want to make sure that the information that we're getting is from a primary source, such as the patient, and that it's credible information. We want to be able to distinguish normal from abnormal findings and identify risks for those abnormal findings. In Block 1, the focus for you guys is primarily just identifying what is normal. What does a normal person look like? What does a normal assessment contain? And then what are some abnormal findings that I might find? And sometimes you don't know exactly what the finding is, but as long as you're able to identify that's not normal, we're very happy with that progress in Block 1. We want to be able to distinguish relevant from irrelevant data. So sometimes patients will start to talk about things that just aren't related to why they're there or information that we're trying to get at that point. So oftentimes we have to use redirecting or refocusing, but you want to be sure that you're only using the relevant data that helps you to formulate appropriate diagnoses and things like that. And then identifying assumptions and inconsistencies, so kind of seeing if things don't line up appropriately from what the patient's telling you to what you're seeing, checking accuracy and reliability, that kind of goes along with that, and recognizing missing information. So if you're thinking that there's missing information, you might have to go back to the patient and ask them to follow up or ask them follow-up questions such as, can you tell me more, or can you continue, something like that, where you're kind of prompting more information from them. The characteristics of a nursing assessment, the things that you want to have, you want it to be purposeful, prioritized. So a biggest thing about prioritization is understanding what comes before what, or what is higher priority than another thing. So for instance, and later in the presentation in the diagnosis section, or planning, we'll talk about how you prioritize problems. But prioritization would be something like if the patient's having an airway difficulty, that would take priority over maybe an ingrown toenail or an abrasion to the lower leg. So you can kind of see you want to prioritize based on the emergent need of the patient. Complete, you want to make sure the assessment is complete and you're not missing anything, especially if you're going to use your assessment to call a healthcare provider, such as a physician or nurse practitioner. You don't want to be missing items that they might ask you on that call. You want to make sure it's systematic, such as a head to toe fashion, or in a fashion that meets the patient's needs as well. And then accurate, relevant, and recorded in a standard manner. You're going to have a standard way of recording, such as electronic health record or maybe paper charting if they're still doing that. So whatever your facility is doing for that type of recording, you would want to adhere to that. We have a few types of assessments. So we're going to talk about 4 here. We have an initial comprehensive, which is going to be the initial assessment you do when a patient is, when you're first seeing a patient or they're first admitted. So that's going to be something that is more comprehensive. So it could be a full head to toe on a patient so you can get that baseline data. It must be completed within a certain time frame. So we have accrediting bodies that tell us, that have standards that say, all of your assessments need to be completed within X amount of hours to be in compliance. We want to make sure that we get accurate data for that initial comprehensive so that we have a good database and a baseline. And we can then identify any abnormalities that occur from that point on. A focused assessment would be something where we're gathering data about a specific problem. And it's something like if a patient comes in and they have abdominal pain, we're focusing primarily on the abdomen. We might do an initial comprehensive, but then after that, we're going to be focusing on whatever the chief complaint is for that patient. Then we have something called an emergency assessment. That's going to be more life-threatening problems such as airway problems, bleeding problems, circulatory problems, things like that, which as you can assume, it's done very, very quickly. And then time lapse would be scheduled intervals. So if any of you do work on a unit, you probably see or observe the nurses or even yourself as a nursing assistant doing scheduled intervals of maybe vital signs or assessment follow-ups. So that might be every 4 hours. A lot of units have a 4 hour time lapsed, or it could be even 6 hours, or possibly even once a day, 12 hours, or once a shift, I'm sorry. Next, here's a little knowledge check here. Which one of the following assessments would be performed on a patient to gather data about his previously diagnosed liver cancer? Do you think it would be an initial comprehensive, a focused, an emergency, or a time-lapsed assessment? Okay, let's see the answer. It's actually a focused assessment, so if you answered that, great job. The cancer was previously diagnosed, so the visit will focus on that specific problem. Maybe initially they had done an initial comprehensive when the patient first came in, but now that the patient's coming back for a follow-up, we're going to be, because it was previously diagnosed, they're coming in for a follow-up, which would then focus on the specific problem. Let's talk about medical versus nursing assessments. So we have two different types of assessments. Your medical assessments are going to be gathering data that really targets the pathology, so the pathologic condition. So for instance, if a patient comes in with just say a fracture of the lower extremity, the physician is really doing a primary assessment on that extremity and trying to understand what's going on pathologically. So they're trying to figure out, is it fractured? How bad is the fracture? They're going to do, obviously diagnostics and things like that to see that, but they're doing assessments that are targeting information that they need to make a diagnosis, a medical diagnosis. Nursing assessments, on the other hand, focus on the patient's response to the health problem. So a nurse isn't going to necessarily go in, they're definitely going to assess the lower extremity that's fractured, but they're not doing it in a way so that they're able to treat the fracture. They're going to treat the responses to that fracture. So if you can think about some things that a patient might have, a patient with a fracture would have pain, they might have generalized discomfort of some sort. They would have maybe impaired mobility, so their walking would be impaired. So you can kind of think about and brainstorm, what would a patient have if they came in with a fracture? And that's the point of a nursing assessment. So let's look at the next area. This is a true or false question. It's a little knowledge check. A nursing assessment duplicates a medical assessment by focusing on the patient's responses to the health problem. Is that true or false? It's actually false because of that word duplicates. So a nursing assessment does not duplicate a medical assessment. It goes along or goes hand in hand with a medical assessment. But remember, medical assessment focuses on the pathology or the pathological condition, and the nursing assessment focuses on the responses to that pathologic condition. So let's look at some diagnoses here and let's try to identify if they're medical or nursing. Right hip fracture. Good. If you said that that's a medical assessment, you are correct. What about acute pain? Acute pain would be nursing assessment. Very good. What about impaired urinary elimination? Once again, that's a nursing assessment. UTI, or urinary tract infection. Good. That's going to be a medical assessment. Anxiety related to surgical procedure. That is going to be a nursing. Nurses are going to help with the anxiety related to the surgical procedure. However, remember that the physician or the nurse practitioner or whoever is going to be focusing on the surgical procedure itself. And then what about chronic depression? So chronic depression, I put that on there because that's a gray one. So I don't know what you said. Maybe you said nursing, maybe you said medical, or maybe you're like, what is it? Both. It actually is a little bit of both. It's considered a nursing assessment, something that we can, focus on. But in addition, it is a medical assessment, and it's something that many physicians might prescribe for or focus on. So it can be a little bit of both. A lot of times nurses use depression in their care plans because they're able to treat some of that potentially independently. Okay, moving on. Types of data. So types of data, we're going to have objective and subjective data. This is an important slide to remember. There's a knowledge check on the main page of this assessing content, and there's going to be a knowledge check on this, so try to pay close attention to this. It's asking you which is objective or subjective. So let's talk about the two. Objective is going to be observable and measurable. And how I remember objective data is by the word observed. So objective, we have an O in observed. So objective is observed, measurable data that can be seen, heard, or felt by someone other than the person experiencing them. For example, elevated temperature, skin moisture, or vomiting. Those are all things that are going to be observed or measured or felt maybe by somebody other than the patient telling them. Subjective is going to be information perceived only by the affected person. So, how I remember subjective in an easy way is to say subjective is what the patient states. So, states, the S in states, is subjective. So, what the patient states is subjective. For example, pain experience, feeling dizzy, or feeling anxious. So, if the patient states, I have a 7 out of 10 pain, that's subjective. If the patient states, I feel dizzy, subjective, or the patient states, I'm feeling anxious, subjective. Now, there could be some objective data that lets you know that they're feeling anxious. Maybe they're doing things, behaviors that go along with anxiety, but the statement of anxiety is holds much greater value than actually observing it, because what you might consider an anxious behavior might be a normal behavior for another person. So really, if they state they're anxious, you truly know that they're feeling that anxiety. Okay, so moving on. A patient rates his pain as a 7 out of 10 on a pain rating scale. This rating is considered to be objective data, true or false. All right, so thinking back, hopefully you said false. The rationale is that a patient's rating their pain on a pain scale is providing subjective data. So remember, if the patient states it, like as in pain, then that is subjective. How do we gather data? Number one is the patient. The patient's going to be the number one source of data. We never want to go to anybody else but the patient unless we absolutely need to. Family and significant others might come next, as long as that it's been approved by the patient if they're able to. We look at the patient record. We might look at the history, the physicals, the progress notes. We would obviously look at any consultations that occur so we can see what happened with those. Any reports, such as laboratory diagnostics, reports, any therapies by other healthcare providers, such as speech therapy, occupational therapy, physical therapy, and any type of other literature that would be helpful in gathering data. Or even researching a diagnosis, a new diagnosis that we're unfamiliar with, we might look at healthcare literature to help us with that. So remember, number one way to gather data is going to be our patient. Okay, we always go to them first. We never ask the family first. Okay, let's look at the 4 phases of a nursing interview. So in order to get the data that you need during the assessing phase of the nursing process, you're going to have to interview the client. So if you've ever been in a healthcare setting and the nurse comes in and they start to talk to you, that's what they're doing. They're doing their health history, they're doing their assessment, they're essentially interviewing you by not only asking you questions verbally, but using assessment techniques such as inspection, palpation, listening to you as in auscultation, things like that. So the 4 phases of the nursing interview are something that are very important for the nurse to know and be able to, essentially do in their everyday nursing practice. So let's talk about the first phase, the preparatory phase. The words themselves kind of talk about what's going to happen in that phase, which is nice. So the preparatory phase, you can imagine that's preparation. You're going to prep for the interview. You're going to gather any supplies you need. You're going to look at any older health history that you might need to see. You're going to look at the chart if you need to. You're going to look at anything you need to prepare. You're going to gather what you need, and you're going to head into the room. The second phase, introduction, you can imagine what that means. That's where we're going to do our introduction. So, for example, hi, Mr. Jones. This is Jessica, your student nurse. Can I go ahead and check your name and birth date? Okay, he states his name and his birth date. Okay, so we have the right patient here. I'm here today to do a physical assessment and a health history on you. I'm going to be asking you some questions. I'm going to be listening to you, touching you, doing different types of assessment, asking you to do things for me. Are you okay with that? Yes. Okay, good. Is this a good time to do it? Perfect. Okay, so there's our introduction. Now let's move into the working phase. So the working phase is going to be the meat and potatoes. That's what I think of. Like that's where I'm going to get everything I need during this interview. The introductory phase is nice because we build some rapport with the patient. We might, use some techniques there to get them to trust us a little bit to do their assessment. We might calm their fears, tell them, answer questions, tell them what's going on. The working phase is where I'm actually going to do it. So I'm going to start by asking some questions, then I'm going to move on to my physical assessment, then I'm going to maybe, do whatever else I need to do, go over the day, the plan, whatever else. And then at the end, I'm going to terminate. Termination is the biggest thing that I think a lot of nurses miss. And it's unfortunate because you've spent all this time building rapport with your patients and getting what you need, and then you just leave and you never say goodbye. So, what you would do at the termination is you would just say, okay, Mr. Jones, I really appreciate you allowing me to do that. I've got what I need. I've got all the data that I need. I'm going to go ahead and chart this information. I'm going to let you rest for a little bit and I'll be back in X amount of hours or whatever you want to say. Um, Sometimes the termination is the thing that the patient really needs. It's kind of like that closure. So at the end of your shift, maybe saying something like, Mr. Jones, it was great working with you today. I'll be back on Thursday and I hope you're not here, but if you are, I am looking forward to seeing you then. And, whatever else you want to say. Okay. Because they sometimes need that. Okay. So, problems related to data collection, I don't necessarily need to read you the problems related. You can go through these yourselves. I don't even have you, include these in any type of testing or anything like that. But I just want you to know that getting data that is not pertinent, getting data that's not related to what you need or it's irrelevant, um, not getting data because the patient doesn't trust you, so not failure to build that rapport, can all be problems. Okay, and then get documenting something that's an interpretation. So, like I gave you that example of anxiety, if someone's pacing around the room, you can interpret that as anxiety because to you, you don't do that. That's not a normal behavior for you. However, for another person, pacing around the room may not be anxiety. It may just be that they like to keep the blood flowing in their legs. I don't know, something, like that. So you want to make sure you're not interpreting behaviors or interpreting things that you've observed, but rather asking the patient. So if a patient is, pacing the room, you might say to them, I see that you're pacing the room. Is everything okay? Or I see you're pacing the room. Tell me more about it. It's kind of explore that with them. And then making sure you're updating the database. So if you get data on day 1 and now it's day 6, you want to make sure that you're updating the data so that way it doesn't, appear that we're still on day 1 of the patient's admission at the hospital. Okay? So you can read through those a little more in depth. So what we talked about in assessment, we talked about collecting data, we identified some cues, validating the data, clustering the data, and reporting and recording data. We're going to do this in the next slide when we look at a case study. I'll show you how to validate data and cluster it. And then we're going to come up with basically from that data making conclusions or drawing conclusions or making judgments. And that's how you move on to your next phase of the nursing process, which is diagnosis. So let's move on and we'll practice some of this stuff. So let's look at our case study. We have Miss Carla Tompkins. She's being admitted to the medical surgical unit as a post-op patient. Miss Tompkins, a 52-year-old school teacher, is recovering from a below-the-knee amputation secondary to complications of type 2 diabetes. Miss Tompkins is admitted to the unit not only so her recovery from the BKA may be monitored, but also because Miss Tompkins is going to receive preliminary occupational and physical therapy to help her adapt to the amputation. Yolanda, the student nurse, enters Mrs. Tompkins' room, introduces herself, and begins the admission, health history, and physical assessment. So let's talk about this really quick. There's some key things in this case that are going to be important to take forward. So just say you're at the nursing home, okay, and you are the nurse. well, nursing student, I guess we should say, soon to be nurse. But you're going to go ahead and anytime you have a case or even taking care of a patient, you're going to go ahead and think about what's pertinent. So this right here is pertinent. Okay, you can see me highlighting there. 52-year-old. Doesn't matter that she's a school teacher unless that's going to, she's going to need special accommodations or something. She's here for below the knee amputation, so I'm going to go ahead and highlight that. She is here for recovery, so we can just highlight recovery, and then I'm going to highlight she's here for her therapies. Okay, so and oh, also sorry, I forgot. It's due to complications of diabetes. So what we highlighted is we highlighted 52-year-old, we highlighted below the knee amputation, we highlighted complications of type 2 diabetes, recovery, and preliminary occupational physical therapy. Okay, you're the student nurse that's going to be caring for her. Okay, so Yolanda, the student nurse, enters, introduces herself, and begins the admission, health history, and physical assessment. Being that you have this patient, you can already start to think about responses to the medical diagnosis. So, our medical diagnosis is below the knee amputation because of the type 2 diabetes, complications of it. So, what do you think would be a response to having a below the knee amputation? I can think of a few. The few that I can think about would be, well, priority would be pain, maybe some immobility or mobility concerns, and also maybe some psychological, psychosocial type things such as hopelessness or powerlessness, maybe some loneliness, maybe some anxiety. There's a lot that could go along psychologically more than maybe the physical aspects of this. In addition, she's going to have a wound, so there's some skin integrity issues. So let's go back to our presentation. Whoops. Okay, so here we are. Let's go to the next slide here. There we go. Sorry about that. Okay, let's look at our assessment findings. So our assessment findings here are the patient states a 7 out of 10 pain at the surgical site. Patient is comfortable but grimaces with movement. Surgical site is clean and intact, sutures are in place. Moderate amount of serous-sanguineous drainage on dressing, new dressing applied per the order. Patient states, I feel like I don't want to look at my leg, I feel so hopeless. So just based on that snippet of assessments, and I only included a few assessment findings. Obviously, there would be a lot more, but those are the few that I wanted to focus on. So what can we gather from this assessment? We can gather that she's having pain. So that kind of validates our thought of pain because of the pain scale and the grimacing with movement. We can, her site looks good, but she's still a risk for infection because she does have an open site and a fresh surgical site. So we could do a risk for infection based on that information. And then the patient stating, I don't feel like I want to look at my leg, I feel so hopeless, is definitely giving us a validation for our psychosocial type of diagnosis. So those three there are going to help us. And let me show you. Sorry, gives you a little snapshot here. Okay, so with our pen, so these two right here, and it's nice because they're right there, are going to support our pain. This and this, even though they look good, we might say that she's still a risk for infection. Maybe she doesn't have one now, thank goodness, but, and then patient states, I feel like I don't want to look at my leg, I feel so hopeless. This is definitely maybe a depression. I mean, there's so many that we can do, guys, but depression, maybe we also think that she maybe has some hopelessness is another one. Definitely something psychosocial. So you can see by excuse me, by taking this and this, that's kind of clustering our data to give us an indicator of pain. And then here, even by saying that we have excuse me, that it's clean and intact, we still have sutures. We still have a moderate amount of drainage, which can be an indicator of a possible risk for infection. She doesn't have anything showing that she has an infection, but she's definitely at risk because she does have an open wound and there is drainage there. That drainage is okay, but having a wet, moist area is always grounds for a risk for infection if not properly cared for. And then we have something that's indicating that she might have depression or hopelessness by saying those statements there. Okay, so let's go back now. So that's how you would essentially cluster your data. Now, obviously, in a real patient assessment, there would be many more potentially, but I just had a few there to simplify this for you guys. So after you've clustered your data and determined what problems are there, you would then move on to the diagnosis step. In the diagnosis lecture, I'm going to show you guys how to look up NANDA approved nursing diagnoses that match what problems you identified. So by clustering our data, remember we found that pain was one, that risk for infection was one, and maybe a psychosocial one such as depression or hopelessness or powerlessness would be another one. I'll show you how to look those up in the Nursing Diagnosis Handbook to identify some NANDAs that match with those, and then we can move forward.